We've all got a cold at least once in our lives. If Tylenol and Advil don't work, we go to the doctor to get an antibiotic prescription and it sorts itself out within a week or two. But imagine, you keep taking these antibiotics and the infection still persists. That's what antimicrobial resistance looks like. Antimicrobial resistance describes the phenomenon that takes place when bacteria acquire resistance against the antibiotics that we usually use to kill them. It is a growing issue, especially in developing countries. In India, antimicrobial resistance was associated with over 1 million deaths in 2019, making up nearly 11% of the total deaths in the country that year. Why does antimicrobial resistance occur? It is directly linked to how antibiotics are used, especially their misuse and overuse. In 2010, India recorded a staggering 12.9 billion units of antibiotic consumption, the highest in the world. Such overuse fosters environments where resistant bacteria thrive, outcompeting non-resistant strains. This resistance leads to an exponential growth of bacteria that cannot be treated with standard antibiotics, posing a grave threat to public health. Misuse of antibiotics often stems from easy over-the-counter access, self-medication based on hearsay or online information, and incomplete doses due to financial constraints. Additionally, environmental contamination from pharmaceutical and agricultural industries contributes to the spread of resistance. Combating this growing crisis requires a comprehensive, multi-pronged strategy. Education is crucial to raising awareness about AMR. Despite millions of deaths linked to antibiotic resistance annually, public knowledge remains limited. Mass media campaigns and inclusion of AMR awareness in existing health initiatives like the revised National Tuberculosis Control Program can help educate the public on proper antibiotic use. Sanitation improvements and infection prevention must also be prioritized. Programs like Swachh Bharat Abhiyan should receive increased funding and community engagement to ensure access to clean water and hygiene facilities. Moreover, mandatory infection prevention control training for medical professionals is essential to reduce infection rates and promote best practices in healthcare. Surveillance and research play a key role in understanding resistance patterns and antibiotic residues in industrial and agricultural settings. Increased funding for research institutions can facilitate the collection of vital data and the development of targeted interventions. Simultaneously, global collaboration on antibiotic development is necessary to create treatments for drug-resistant infections. Regulating antibiotic use in healthcare, agriculture, and food production is perhaps the most critical step. Governments must establish frameworks for responsible antibiotic usage and promote antibiotic stewardship programs to ensure correct prescriptions, dosages, and usage. These efforts should be adapted locally based on regional resistance patterns identified through research. By addressing AMR from multiple angles, India can significantly reduce its impact, safeguarding public health and ensuring antibiotics remain effective for future generations.